Good morning and welcome to the 2021 Legislative Forum on Aging Issues. This forum is sponsored by the Arlington and Alexandria Commissions on Aging. I am Barbara Waters, known as Babs Waters, Chair of the Alexandria Commission on Aging, and I am with Linda Kelleher, Chair of the Arlington Commission on Aging. And we thank you for joining us this morning via Zoom for a discussion on aging issues by a panel comprised of state senators and delegates. And at this point, I'd like to say sincerest congratulations to Delegate Herring on her re-election, and congratulations to Elizabeth Bennett Parker on her election. These two members of the delegation from Alexandria are very, very welcome to be here today. For your information, the General Assembly will be held in Richmond from January 12th through March 12th, 2022. Our focus this morning will be on the 2022 General Assembly legislative and budget priorities of the Northern Virginia Aging Network. But first, what is the Northern Virginia Aging Network, or NVAN as it is known? I will now introduce Linda Kelleher, Chair of the Arlington Commission on Aging, who will tell you about NVAN. Linda.
Good morning, and thank you, Babs. Pleasure to be here, and welcome delegates and those in the audience. NVAN is made up of staff representatives of the city of Alexandria, Arlington, Fairfax, Loudoun, and Prince William counties, members of the local commissions on aging, and representatives from several of the allied organizations, including the Alzheimer's Association and AARP. Participants meet every month to learn about issues and discuss and craft a current legislative program for the General Assembly, and to hold a breakfast each fall to present the NVAN platform to state senators, delegates, and candidates. The moderator for today is Cheryl Beversdorf, a member of the Arlington Commission on Aging and co-chair of our Public Information and Outreach Committee. Before I indicate Cheryl's other biographical information, please let me add my congratulations to our Arlington delegates who are with us today on their successful election. We are very grateful to have you, and thank you for listening to our needs. Getting back to Cheryl, she is also the host and producer of a local radio show called Aging Matters, which can be heard every Tuesday at 2 p.m. and Friday at 4 p.m. on WERA 96.7 FM in Arlington. It's also available on Apple and Spotify podcasts. Cheryl interviews guests on subjects of interest to older adults and their families. And thank you, Cheryl, for being our moderator today. I'd like to turn it over to you.
Thank you very much, Linda, and it's a pleasure to be here. And I'm pleased to welcome Virginia senators and delegates from the Arlington and Alexandria area to participate in this interactive forum to discuss legislation affecting older adults, people with disabilities, and their caregivers, as well as plan for the 2022 General Assembly that begins in January. So please let me introduce each of the delegates and the senators who will be participating today. The first is Delegate Rip Sullivan, who represents the 48th District, which includes part of McLean, Northwest Arlington, and along the river through Crystal City. So Delegate Sullivan, I see that you're here and you can show yourself, and thank you for being here. The second guest is Delegate Alfonso Lopez, who represents the 49th District, which includes South Arlington and part of Fairfax County. The third delegate is Delegate Charnel Herring, who represents the 46th District, which includes Alexandria and Fairfax. The fourth delegate is Delegate-elect Elizabeth Bennett Parker, who represents the 45th District, and that includes Alexandria and the southern slice of Arlington. So welcome to all the delegates. And now I would like to introduce the Virginia Commonwealth Senators, and they include Senator Barbara Favola, and the 31st District. Is Senator Favola on the list yet, Steve?
I don't see on the panel, but if by chance she's in the audience, just raise your virtual hand and I can bring you to the panel.
Okay. I will introduce the other senators. Senator Adam Evan, who represents the 30th District, and that includes a sliver of South Arlington, much of Alexandria, and portions of Fairfax County. And their next senator is Senator George Barker. Is he, I didn't see his name here. Steve, is he with us?
I don't see Barker. I see Baker, Justin Baker, but not Barker.
Okay. All right. And then I also noted that Senator Janet Howell has joined
Yes.
us, and she represents the 32nd District, which is a part of Fairfax County and Arlington County, part of Arlington County. So have I covered everybody? I guess we will have to wait for Senator Favola and Senator Barker.
Yeah,
Cheryl, you forgot one thing.
Yes?
The 49th district is the best district in the Commonwealth of Virginia.
I'm sorry I didn't say that, but
Thank you. Just correct the record.
all right, I will add that to my notes.
okay.
Okay. So at this time, before we start the questions, I'd also like to introduce Erica Wood, who is a member of the Arlington Commission on Aging Legislative Committee, and she's also a member of the Commonwealth Council on Aging. And Erica will serve as the timer today. So here is the format that we will be following. The responses to the questions should be about 2 to 3 minutes in length. And at approximately 2 minutes and 30 seconds, if you're still talking, Erica will indicate that you've reached that point. And then at 3 minutes, she will thank you for your response and we'll move on to the next question. So to begin with, we have 5 topics that we'll be covering. And for 4 of the 5 selected topics, 2 legislators have been selected to respond to the 2 questions. And for each topic, I'll indicate to whom the questions will be directed. And then before I give you the questions, I'll give you a slight overview about the topic and then ask the 2 questions of the designated legislator. And then after the first one responds, then I'll ask the same 2 questions of the second legislator. And there is one topic in which only one legislator has been asked to respond for the 2 questions. And actually that's Senator Barker, so I hope that he will be joining us soon. And if there is time, if we get through these questions, then we have some additional questions to ask. So I'm got a lot of questions to ask today. And when those additional questions occur, anyone on the panel is welcome to respond. And we'll be doing this for about 45 minutes. And then following this part of the forum, we'll ask the panel members to respond to questions from the audience. And Steve Gurney, who you heard earlier, the founder and director of Positive Aging Community, will convey those questions to panelists. So
Okay.
let me get started with the first question.
One note, Cheryl, that I just want to make a note of
Okay.
is that Senator Howell is not able to make it. She had an appointment pop up, but her legislative assistant is on and is on the discussion. So if there are questions specifically for Senator Howell, they'd be directed to her legislative assistant.
Okay. And that person's name is?
Edna Wisner.
Okay. Okay. All right. So the very first question will be directed to Delegate Bennett Parker and to Delegate Sullivan. First, the overview. The Virginia Freedom of Information Act is very narrow. Virtual meetings of public bodies, including legislative committees, advisory groups, and commissions, have only been allowed under an emergency exception to the Virginia Freedom of Information Act. Our experience has been that virtual meetings have worked quite well during this pandemic period and actually resulted in greater public participation. So the first question, and there are actually two questions here, do you support allowing electronic meetings of public bodies? And secondly, do you think this would especially affect older adults and people with disabilities? Delegate Bennett Parker.
Thank you for the question, and thank you for organizing this event. Honored to be with you all this morning. So yes, I am absolutely very supportive of allowing electronic meetings outside of an emergency. This is actually something I've been working on for almost 2 years now, starting with actually the ability for individuals to participate electronically, or for increasing the flexibility for individuals to participate electronically when there's a physical meeting happening. But then last year, as part of that effort, starting to shift the conversation around allowing electronic meetings outside of an emergency, given that we've seen throughout COVID that having electronic meetings have absolutely increased participation in our government meetings and the ability of people to participate in our boards and commissions. So I have been working closely with other stakeholders, as well as the Virginia FOIA Council, which makes recommendations to the General Assembly on matters dealing with FOIA. And so I have been working with the Virginia Municipal League, the Virginia Association of Counties, the Virginia Press Association, and the Virginia Coalition on Open Government, because all of these are stakeholders that have different interests when it comes to electronic meetings. And with the efforts around the individual participation piece, as well as codifying the ability for public bodies to have electronic meetings during an emergency, and sort of allowing people to talk about more than just the emergency. Those folks were key to that effort and getting everyone on the same page, because there's some differing interests and differing opinions there. So we've come up with a sort of consensus proposal that we can all agree on. We don't agree on everything, but we think this is a good path forward in terms of allowing all public bodies to meet electronically outside an emergency. Currently, that proposal would be limited to 25% of meetings, or 2, whichever is greater. I personally would love to see that higher. I think that's a little bit limiting, especially for our boards and commissions made up of volunteers, and especially the subcommittees. I know from talking with members of our Commission on Aging in Alexandria, I know members who, at least one member who had to resign because she couldn't make the 11 a.m. subcommittee meetings in addition to the other meetings, just given her work schedule. And sort of to the second part of your question about does this affect older adults and people with disabilities? Absolutely. I've heard that time and time again, from whether it's, needing to drive at night to get to meetings, or folks just, we know that requiring in-person participation creates barriers, whether that's transportation or others, and just opening this up really makes things more accessible for more people to participate. So that sort of draft proposal that I was talking about will go to the full FOIA Council next week. So I'll be down in Richmond for that. And our hope is that the FOIA Council would sort of bless that or sort of provide that as a recommendation to the General Assembly for next session.
Okay, thank you very much, Delegate Bennett Parker. Delegate Sullivan, do you need for me to repeat the questions?
No, Cheryl, thanks. I've got it.
Okay.
First, let me take just a couple seconds of my time to welcome Delegate-elect Bennett Parker. I think this is probably her first public event since her election, and I just want to welcome her to the General Assembly, to the Democratic Caucus. We're really thrilled to have you on board, and the people of Alexandria are going to be very well represented. Welcome, Elizabeth. The short answer to your question, Cheryl, is yes. I do support additional public meetings by virtual means. This has been part of that very interesting sort of parlor game of what's going to stick post-COVID in terms of effects COVID's had on our world. And I think meetings like the one we're having right now, it falls in the category of things that are going to stick. Our experience with the General Assembly when we met virtually, at least the House of Delegates earlier this year, was in the main very positive. I don't think any of us would want to go to a point where the General Assembly always meets virtually. In fact, obviously the 2022 sessions plan to be an in-person meeting. But we did find, A, we were able to conduct our business quite well, very efficiently virtually, and B, we did find that participation from the public was actually up. And we got a lot of positive feedback from folks who wanted to participate in, for instance, committee meetings. We all know how difficult it is to get to Richmond sometimes. And the stories are legion of folks who will travel 2, 3, 4, or 5 hours to Richmond to come to a committee meeting to testify, only to either not be able to or have the bill they're interested in be put off to the next week. And it's a long way to go sometimes for a minute or two of testimony. So allowing people to testify remotely was really a very positive and inclusive step. Allowed a lot of people to participate who might not have otherwise been able to. So as I said, the short answer is yes. It'll be interesting to see how Elizabeth does in front of the FOIA Council next year. There is this balance that I think folks are looking for between, as I suggested, meeting all the time virtually or everyone being virtual. Because the fact is, sometimes being in one room is better than this kind of form. It's just sometimes harder, at least, to have those kinds of interactions. But I'm confident we're going to be able to strike a balance. Elizabeth's, I know, been working hard on this issue, and I do think this is the wave of the future. That more meetings like this will be virtual, and we have to, of course, always be consistent with open government and making sure that people have access to what their government or portions of their government, commissions and councils and things like that might be doing. And of course, yes, this does affect the older community who sometimes have more difficulty traveling, getting around. And so we want to make these things accessible to them. Thank you, Erica. That was very polite of you.
And I just see that Senator Favola has joined us. So nice to see you again.
Nice to see you, Cheryl. I apologize for my tardiness. I somehow missed this on my schedule. I'm really sorry.
Well, you've got a little time to catch your breath because the next question is directed to Senator Eben and to Delegate Lopez. Bit of an overview initially. During the emergency, new and approved tenant eviction protections were implemented. These included extending the time within which a tenant can address non-payment issues, adding information about legal and financial assistance in written eviction notices, better access for tenants and landlords to rental assistance, and a pilot court diversion program. So here are the two questions. Do you agree that these protections helped improve Virginia's poor record on evictions? And secondly, do you favor continuing these or similar protections for tenants? Why or why not? Senator Eben?
I agree that they were very helpful to a lot of people and helped keep a lot of people housed during the pandemic, which was really critical, not just for humanity, but also for public health. And in terms of extending them, I'm open to extending most of them. The challenge is that we have to see what kind of money we have for continuing rental assistance for emergency situations. What we don't want to do is just have people extend the amount of debt that they have and then still be faced with an eviction. I think, though, that there's some that are really important, like letting people know about the legal remedies they have of who can represent them in these kinds of proceedings, and the 14-day notice is important. So yes, it's not a full 2 minutes, but they've been helpful, and I'd like to see as many of them continue as possible, particularly 14-day notice and access to legal services. The money, though, for rental assistance, we have to see what we get, because federal money, I presume, will be tapering off eventually.
Okay. Delegate Lopez, do you need for me to repeat? The
No, I
question?
got it. Thank you, Cheryl.
Okay.
So one fact that really makes me incredibly happy is that in the middle of the pandemic, in the height of the pandemic in 2020, we had fewer evictions in Virginia than we did in 2019. In the height of the pandemic, we had fewer evictions than we did in 2019. Why is that? As a part of the CARES Act, we got $522 million to address all of the eviction prevention and support and rental assistance programs across the Commonwealth. We were able to also create a mortgage and rental assistance relief program in those first months of the pandemic. And then on top of that, we were able to increase the Affordable Housing Trust Fund up to $125.7 million, which was then used as the backstop for the mortgage and rental relief program that we were able to create. And so what does that mean? That means that we had funding, and we still have funding available for these programs. Now, Senator Evans is correct. They eventually will taper off. And the issue for us is about getting people to avail themselves of the program and making sure that landlords knew about the program, that they were actively working with the program, and that also that it was accessible. Because we were finding, especially in places like Route 1 corridor and parts of Richmond and especially South Arlington, where you have countless languages being spoken, or actually over 100 languages being spoken, that there were language access issues, and that there were some translation issues that needed to be addressed in that middle ground. So there are several things we have to do to sort of build upon what we already have in place through the regulatory process. One is we need a bare minimum livable standard for housing in the Uniform Building Code of Virginia. We also need to strengthen the prohibitions against retaliatory evictions. So we're finding that in places like the Serrano apartment complex along the Columbia Pike corridor, this sort of rogues gallery of problems. And if it's happening in South Arlington, it's happening in every corner of Virginia. And so on top of that, I'd like to pass a warranty of habitability. And so, like, if you are renting a place to somebody, it has to be habitable. You have to avoid mold issues. You have to avoid having leaking roofs. You have to avoid all of these things. And what's also happening is that we're finding, anecdotally at least, that more often than not, the people who are suffering in these conditions are elderly. And so what I'm concerned about is exactly what Senator Evan was referring to, is that with the federal funding eventually rolling out, we have to have the backstop. We have to have that legislative firewall in place to make sure that we're not jumping off of a cliff in terms of how people are going to be dealing with potential evictions or the inability to pay their rents or mortgages.
Okay, Steve, I wanted to check again. The next question was to be directed at Senator Barker. Has he joined us or not yet?
Let's see. I don't see Barker, but however, hold on a sec. Okay. Okay, sorry. Justin Baker is representing Delegate Hearing. Okay. Okay. Yep. No Barker right now.
Okay, well, I'll go on to the next question. Perhaps he'll join us a little later. The next question is directed to Senator Favola and also to Senator Barker, but he's not here. So Senator Favola, for at least the last 20 years, nursing home staffing standards have been proposed in the General Assembly and failed. In October, the Joint Commission on Healthcare issued its report calling for nursing home staffing standards. This report recognized that 1/5 of Virginia nursing homes are not meeting expected staffing levels, which directly impacts quality of care, especially among low-income and minority nursing home residents. The report further recommends a method to fund this staffing requirement to ensure that any increase in Medicaid nursing home reimbursement levels translates to more staff. So here are the two questions. Do you support a staffing standard in nursing homes? Why or why not? And then what are the chances of nursing home staffing standards being enacted this legislative session, and would you support such legislation?
Thank you for the question, Cheryl. I do support staffing standards. We, as you know, have gotten a lot of pushback from the industry. They will argue that, 75% of the nursing homes in Virginia, the skilled nursing facilities that do receive Medicaid dollars, meet what they would say the average staffing standard. However, the nursing homes that have a fairly high percentage of Medicaid patients tend to not meet the average nursing standard, and we have high turnover among the individuals working in those nursing homes. The biggest request we are getting from both advocates and providers is to increase the Medicaid reimbursement rate and maybe have an additional reimbursement rate for nursing homes that have a high percentage of Medicaid patients. That would have to be defined. So the committee is very much looking at ways to improve the quality of care. And I can say that there seems to be some growing consensus that if we in fact increase Medicaid reimbursement and we give an additional delta to those nursing homes that have a high percentage of patients on Medicaid, that we have to have some accountability that those dollars are being used for staff. So either increases in salary, training, retention. So that's what we're struggling with right now, is how to bring the industry along. We want to be strong partners, but we do want to ensure that any additional dollars we allocate actually are used to improve the staff ratio and to improve the training of staff in our nursing homes. Thank you.
And Senator Favola, I apologize. I saw you had your hand up when there was the discussion a little bit about the tenant eviction. Did you want to add something?
I just wanted to add one thing. I mean, both Senator Eben and Delegate Lopez gave such thorough answers. But my one thing is, you might find this encouraging. The Apartment and Office Association is in the process of talking to lawmakers. They are going to advocate for an emergency eviction fund. So that might help us with building a coalition to get that in place, because landlords want to avoid evictions as well. And I just think we need to keep that in mind. Thank you, Senator Eben. I see you nodding.
Okay. The next question is directed to Delegate Herring and also to Senator Favola. So here it is. A little overview first. Last year, a small group of home care workers won 5 days of sick leave paid through Medicaid. Direct care workers in nursing homes and assisted living facilities, as well as other home care workers, are not covered by this legislation. The two questions are as follows. Would you support expanding this legislation? And secondly, is 5 days of paid sick leave enough? Start with you, Delegate Herring. Why don't we start with her, and then we'll go to you, Senator Favola.
Sure.
Excuse me, Delegate Herring is, unfortunately, she had a prior engagement that came up again, or the engagement that came up. So my name is Justin Baker. I'm staff for Delegate Herring. As far as expanding that, I think that's something that she would want to look into, and then I'll defer also to the Senator.
Thank you, Justin. I absolutely believe we should expand the 5 paid sick days to agency employed personnel who are in individuals' homes, and to those who are providing that direct care in our skilled nursing facilities and in our assisted living facilities. These individuals are doing hard, challenging work, and they're serving our most vulnerable populations. And we do have precedent. The 5 days did pass last year, both in authorizing language and in budget language for consumer-directed home care workers. Consumer-directed would be individuals that would be hired directly by the consumer and not going through an agency. And these folks, for the most part, are reimbursed by Medicaid. So the consumer-directed folks. So we have that in law already. And the logic behind picking up that cohort of employees is the same logic that would extend to individuals doing the same type of work in a different setting. They're either, hired by an agency to go into an individual's home, or they're actual employees in these nursing homes or assisted living facilities. I think we need to start with the 5 paid sick days. I think going beyond the 5 would probably be a stretch in this environment. And I am sure providers would again ask for an increase in Medicaid reimbursement if this were to go through. So there are a lot of balls we'll have to sort of balance in the air, but I do think the 5 paid sick days is a good place. It's the right spot for us to advocate for.
Okay. Thank you, Senator Favola. I'm going to ask one question, which, as I said, I was going to direct it specifically to Senator Barker, but I think it's such an important issue. And I will even throw in, after I ask the 2 questions, that I interviewed someone, the coordinator about VICAP, which is the Virginia Insurance Counseling and Assistance Program, this very week. And I have to tell you that she talked about how important VICAP was, particularly right now during the Medicare enrollment program. So I'm going to throw this out. If anyone would like to answer this question, fine. If not, at least I wanted to make all of you delegates and senators aware. The Virginia Insurance Counseling and Assistance Program, as I said, it's also known as VICAP, offers counseling to Medicare beneficiaries and those eligible for both Medicare and Medicaid. It also provides counseling to their families. And as you probably know, Medicare and the Medicare-Medicaid programs are complex, and this counseling service has proven to be invaluable. Currently, the program receives only federal funds, which are insufficient based on demand. Many states supplement the federal funding. So the questions would be, would you support putting state money into VICAP? And remind you that the NVAN platform asks for a $600,000 budget amendment. And would you support this? Why or why not? So I throw that out to any of the legislators here.
Sure. This is Senator Eben. If I could address that, I had told, I believe it was the Alexandria group, that I'm happy to put in the $600,000 budget amendment if the governor doesn't include it in his budget. We know it's important for getting people as much healthcare coverage as they can get, and getting it to them smartly and what makes sense for them. And happy to assist with that. It's a program that works, and leveraging both volunteers and paid staff. So it's a good program. It works and helps people get healthcare. I'm all for it.
Cheryl, I think you're going to find a lot of nodding heads on this.
Yeah.
On this call.
Good.
Adam, I'd given the same advice to Herschel and Erica and folks I met with. They ought to be talking to the governor. And frankly, at this point, ought to be talking to the incoming governor as well, but they ought to be talking to Governor Northam. This should be, best way to do this is get it into the governor's budget. But any of us, I'm sure, would be happy to carry the budget amendment should it not get into the budget.
I wholeheartedly agree. And Adam, I'm happy to co-sign your budget amendment. So one thing I want to add is I actually think it could be a cost saver as well, because the more individuals we pick up who are actually eligible for Medicaid or Medicaid expansion, or they didn't apply for Medicare on time, or they might qualify for a subsidy on the exchange, that we're picking up more uninsured individuals overall. That will help reduce our healthcare costs, this is the right thing to do. And I'm really glad that, and I'm not surprised that the delegation you have here in front of you would be very supportive of this.
Yeah, and thank you, Senator Favola, because it was very interesting when I interviewed Michelle Thomas, who is the coordinator in Arlington. She talked about how oftentimes the counselors on VICAP were able to help save thousands and thousands of dollars for beneficiaries. Not only that, but even to go ahead and help them kind of navigate these advantage plans right now, because there are so many out there, and older adults and their families don't necessarily know. So I'm as the producer and host of Aging Matters, I'm really glad to hear that. And I would also encourage people to listen to the program next week, because it really covers Medicare update extensively. So I want to move on to a couple of additional questions, and this will be for all of you. So whoever wants to speak first, go ahead. The first one is, obviously you're familiar with the NVAN 2022 legislative and budget priorities. Which of these might you be interested in sponsoring or serving as a patron in the General Assembly this coming session? And I start with whoever wants to talk first.
Cheryl, I'll jump in. I have to say, obviously, Tuesday's election results are likely to change things. Candidly, at this point, I haven't quite figured out exactly how, but they're going to be different than at least some of us had hoped for. I know that the NVAN has got a bunch of priorities that interest me. The Ombudsman program needs to be better funded. I know there's some initiatives y'all have having to do with folks with Alzheimer's, which is a personal issue to me that I'd love to be helpful on. And again, I told Erica and Herschel this when we got together. Delegate Corey's the real champion for this issue, but I personally think we do a very terrible, we're not good in this country in dealing with end of life issues. And I know the issues having to do with medical aid and dying have been sort of bubbling around the General Assembly for years. I think it's a heavy lift, but something that interests me. We need to be better at end of life issues for all sorts of reasons. And that's something that I'd like to be involved in.
Okay. Thank you, Delegate Sullivan. Senator Favola?
I agreed. And Erica, correct me if I leave something out, but I agreed to carry the 5 paid sick days for, again, individuals that are working in the nursing homes, assisted living, and working for agencies and home care placements. I also agreed to work on the nursing home standard issue. And I agreed to co-patron the increase in the Ombudsman office. I have been putting in that budget amendment multiple times, but Senator Eben, I think you've been putting in that budget amendment as well.
I'm on the subcommittee that deals with it, and I'm happy to co-sponsor yours, but I have not put it in myself yet.
Okay. So thank you. We'll work on that, better funding the Ombudsman office.
Anyone else want to add anything right now?
I would just say that to what Rip alluded to, it's going to be, if we're at 48, or even if we get back up to 50-50, the negotiation process will be a lot different than it was when we were 32 and 34 in the House delegates, or when we had the majority. But it will be considerably more difficult to accomplish a lot of the initiatives that we think are no-brainers up here, but for the rest of the Commonwealth are going to be problematic. And so I would hope that you would have some patience with us as we sort of navigate this new reality in the Commonwealth. just keep that in mind with regard to the NVAN priorities, especially with regard to the budgetary priorities.
Okay, I was going to ask two more questions. First of all, I know that Senator Howell's staff member is on, and you just spoke about Delegate Lopez about budgetary. I didn't know if the staff member of Senator Howell wanted to say anything about budgetary issues, or is it a little too early to talk about that?
I don't know if they're muted, but just as a general note, we'll be hearing from the governor with the governor's budget in the, I believe in the first or second week in December on their priorities. And then the process, if there's something that's not in the governor's proposed budget that NVAN would like to see or anyone would like to see, it's incumbent upon them to work with legislators so we can propose a budget amendment. And the best budget amendments would have a sponsor both in the House and in the Senate so that we can bring it forward. But fiscally, the Commonwealth is looking pretty good. I don't know how many new programs will be established or if the governor's going to propose beefing up existing programs to where they need to be. But December is when you really see a lot of action on the budget by analyzing his proposal.
Okay. And I was going to ask one more question to all of you again, and then turn it over to Steve to take questions from the audience. Based on what we were talking about today and what's in the NVAN platform, are there any, you kind of alluded to it already, Senator Eben, but any additional issues that are affecting older persons in Virginia do you foresee the General Assembly would need to address? And I'm thinking also, as you meet with your constituents and they tell you things maybe that we in the Legislative Committee and Commission on Aging may not have thought of. And I was just wondering if there was anything else you wanted to add before we get questions from the audience. Delegate Lopez?
Yeah, the drinking water system in the Commonwealth of Virginia, especially in rural, poor parts of the state, is atrocious. If you're immunosuppressed, elderly, or infant, don't drink the water in Wytheville. Don't drink the water in Grundy or Galax. We have a significant problem in terms of drinking water safety and basically barreling through the EPA safe drinking water standards in terms of lead and copper. And so we have sort of pushed this under the rug for decades, and it's a costly issue, but something we need to address. When the answer from your local health agency is that you should just use a filter as opposed to drinking shit out of your tap, that's an issue for me. And so I know it's not such a significant problem up here in Northern Virginia, but you know, Southside, Southwest Virginia has a significant problem when it comes to this, and we need to address it.
Okay. Thank you, Delegate Lopez. Anyone else? Issues that have been brought to your attention that we need to think about on the commission and add to the platform?
The platform was really thorough that you presented, and really appreciated all the background materials that were with it. One that I'll mention is I'm working with the Virginia Poverty Law Center on a Safe and Healthy Homes Act that landlords that don't keep their dwellings in a habitable state could be held accountable to do that.
Okay.
I think that's important for rental housing.
One other issue that may be important to your constituency and to others is, I know there is a movement to look at building standards in homes to make our homes that are renovated or newly built more environmentally friendly. A lot of carbon emission actually comes from your home. So that would be something that I think folks would be very interested in. I really sincerely hope we can continue to make progress on the Clean Economy Act, which I know Delegate Sullivan was the chief cheerleader in the House, and many others helped move that forward. But the whole issue of climate change is really all encompassing, and when we need to deal with that.
Well, and to your point, I've had several people on Aging Matters who have talked about how climate change is affecting the health of older adults. So thank you for saying that, Senator Favola.
Sure.
I'm now gonna turn it over to Steve to take questions from the audience. Steve?
Okay, here we go. All right. Well, first we've got Bob Eifert who just asked a question, and then we will address the questions that people asked when they signed up. And Bob says, for any or all of the legislators, in light of the change to the legislative landscape last Tuesday, what are the chances for any of the initiatives? And what are your other legislative priorities? And I know some of you may have answered that, but if anybody would like to comment.
I think the real answer to the question is, I don't know. And I doubt anyone on the call really knows. The incoming governor, to my knowledge, has never been particularly engaged on, at least publicly, on any of these issues. From my perspective, he's at the moment sort of a question mark, or at least a blank slate. And I guess the positive way to look at that means he may be amenable to hearing about some of these issues. So y'all ought to start opening channels with the incoming administration. I don't know how he feels about these issues, but he ought to be concerned about these issues. And administration, I would hope his administration would be supportive of a lot of these initiatives. But the reality is, I don't think we know.
I will just say that depending on the tax cutting strategy, that will have a lot to do with whether we can actually fund certain initiatives. So at the end of the day, public services have to be paid for with tax dollars, and there are trade-offs, and those will be the conversations that I think will be the most challenging, perhaps, when we reconvene in 2022.
Let me just say that Virginia is already doing quite well in terms of budget surplus. And with the passage of the potential or eventual passage of the infrastructure bill at the federal level, we're looking at another $4 billion that's going to come to the Commonwealth of Virginia. Now, a lot of that's going to be earmarked for specific projects, but I fully expect that this administration will spend like a drunken sailor and give everyone back tax cuts and significant like tax rebates as a political ploy, as opposed to balancing and saving for a rainy day. So, and also we've had a significant turnover on the Republican side in the House. And what does that mean? That means that a lot of the folks who might have been, serious rock-ribbed Reagan Republicans are being succeeded by Trumpers. And they're going even further to the right. And so as opposed to moderating their message, they're doubling down on Trumpism. So goodness knows what the dynamic will be in the House, even with a closer dynamic with or closer numbers with 52-48. Maybe live in interesting times.
Great. Let's see. This is an interesting question that came in registration. A number of states do not tax retirement pensions. Has this ever been considered in Virginia, and how would you feel about it? Has anybody given thought to that?
I have. I've had some constituents raise this issue. We have a lot of federal retirees in our neck of the woods. So the answer is yes. I've given it some thought. Again, I haven't a clue what the new administration will feel about these kinds of issues. Governor-elect Youngkin talks an awful lot about tax cuts. So this might well fit into his program. On the other hand, one of the things I think the governor-elect's gonna learn is we do have to balance our budgets in Virginia, and if you can't pay for something, it doesn't get done. And so we'll see where he comes out on that.
The governor-elect has spoken about not taxing military pensions, from what I've heard. But one thing he's going to have to reckon with is that he's going to have to deal with the legislature, and that changes to things that he wants to do, if he proposes certain things, have to go through the House and the Senate. And the Senate has a Democratic majority in all of its committees. So a few of the committees have some pretty significant majorities, including Finance and Appropriations that Senator Howell chairs and that I serve on. And there won't be a lot of fiscal changes with significant changes without going through those committees, as well as the General Assembly at large. So it's going to be challenging to get some new things done, but everything's not going to change overnight in terms of going unilaterally repealing existing programs or balances.
Right.
I think the real issue will be how much farther we can go in terms of implementing programs that we know we've needed to implement or that we need to bolster because the dollars are not sufficient to meet the demand. So, I mean, it is very much going to be, I mean, based on my understanding of Governor-elect Youngkin's position, it's very much going to be the tax and spend arguments and how they're balanced. And Senator Edmonds absolutely right. I mean, the General Assembly is going to play a big role, and right now the Senate is in Democratic hands in the majority, but it's not a large majority. It's
let's see, in Wendy Zenker asks, I hope the panel members are familiar with the recently issued Joint Commission on Healthcare report on strategies to support aging Virginians in their communities. One of the recommendation is that they could introduce legislation to create a grant program to develop and expand community-based volunteer organizations that provide caregiver-like services to their communities. I just wanted to share that statement from Wendy. And let's see.
I can respond to that a little bit if you're looking for a response, or if you
Sure,
want to
sure.
move on to something else, that's fine. I would just say many of us in this activist community, myself included, I mean, we're looking to see what will actually pass in the investment bills that the Congress will act on. You know, they've got the infrastructure and they've got the human investment bill. So I read there was language that actually would have granted some tax credits to caregivers at home, and some language that could bolster grants to the nonprofits that you just discussed. So it's, I think we're probably waiting to see what actually passes at the federal level and how we could complement that to actually, I think, bolster our home care safety net.
Right. And Jane King asks, do you expect that the Senate can prevent voting restrictions?
Yes, I'm on the Privileges and Elections Committee, and I don't see any appetite for moving backwards on, particularly with the current Senate composition on voting issues. We've made a lot of advances, made it a lot easier to vote. We saw a great turnout the other day, partly by 45 days of early voting. And I think we're going to see that. In fact, things are going to go further. Next year, we're going to have same-day voter registration. That's already in the law. It just becomes effective next year.
Hang in there, Adam. Go get them.
And let's see. Someone asks, is there anything the county can do to support the village model And are there villages in Arlington? There is definitely villages in Arlington, very active community. But as policymakers, is there anything that you all can do to help with the expand the village model of aging in place?
Steve, I just think for purposes of a common understanding, I will just say what I believe the village model is, but please, comment on that. I believe it's a group of volunteers. They've organized themselves and they make themselves available to help with either odd jobs or driving individuals to appointments or to the grocery store, sort of like your nearby handyman or your nearby Uber, except it's a volunteer and maybe somebody you know. Has it expanded beyond that?
That's a great definition, but they come in all shapes and sizes. Some are totally volunteer based, others have a volunteer and paid staff. But I think at the heart of it's a grassroots initiative to create supportive neighborhoods to make it easier for people to connect and age in place in their community.
I think it's a great model, and I know to me, it seems very challenging to have one of these organizations work without a paid staff member. So, I mean, that certainly is something that I would think, the village organizations could ask nonprofits to fund or discuss options with the Arlington County Board, because it definitely, again, it's a quality of life. It's also, good patient outcome, and it does save money. And I hate to keep going back to that, but at the end of the day, we are in that box. So it has a lot of things going for it when individuals can make the choice to stay at home safely and can do so connecting with their neighbors and friends who can lend a helping hand. So it's a value that I think we all respect and want to promote, and I believe the county board would too. So it's worthy of conversations.
Great. Are there any strategies that can be realistically implemented to increase the affordable housing stock in Virginia?
Yeah.
Go ahead, Alfonso.
Fully fund the Affordable Housing Trust Fund. It is pennies compared to what other states have in their affordable housing trust funds. We've gone from 6 million in the first year that we created it in 2013 to 125.7 million as a part of the last budget that was passed by this governor and this General Assembly. But that's still not enough. Now, we definitely got the 522 million from the CARES Act funding, but that's set aside for a specific purpose and it's going away. It's slowly being taken down. You need to empower localities, you need to empower local affordable housing authorities, and you need to fund them properly. And the more you do that and create that sort of middle ground of money that can be the difference between building something and not building something, the better it is for everybody. So the Affordable Housing Trust Fund needs to be funded at a level that is equivalent to similar size states. We need to be having, maybe we're not at the California levels of like $3 billion, but we need to be up there with Pennsylvania and Illinois.
Great. A question about extending the pandemic tenant eviction protections permanently and the right to legal services for tenants. Any thoughts on that?
You want to go, Adam?
I think that, part of it is money. We have to see if we're going to have the emergency fund that Senator Favola referenced that's being promoted by some of the apartment building association. But are you suggesting new legal services or just that people be notified about existing legal services?
Oh, I'm just reading the questions that were typed in at
Okay.
registration. So, you know, I think just randomly commenting on these ones that I'm throwing out.
Sure. I mean, I think I'm supportive of this. I'm not sure how much, when we spoke to the apartment building folks, they were saying, you know, while the amount that could be potentially spent is vast, even an incremental amount would make a difference in a lot of people's lives. What this would be emergency funding for up to a month or two for those people who truly end up in the kind of a crisis. You find out you have an $800 car repair bill that you need to get to work. You pay the bill, you go to work, but you're short on the rent that's due the next day, and that it can make a real difference. So I'm hopeful that we can have some good discussion with that.
Great.
I think the whole issue of affordable housing is taking on multiple dimensions, though. For example, on the governor's G3 program, there, for those that qualify, you know, this is that no cost community college. If you're in the high demand workforce track, there's dollars available to help you meet your housing cost if you reach a crisis. And it would, you know, you can't continue in school because you could be evicted. There's some money available to help. Some jurisdictions, and I believe Alexandria is also doing a pilot where individuals, select group of individual households will be getting dollars sent to allow them to live better or make different choices. So I think there's a lot going on in terms of trying to make living more affordable in this area.
Yeah, and one interesting initiative in Montgomery County, Maryland is home sharing to create affordable options. And I'm just dropping a link to that program into chat for the audience, and that might be something that, to talk to the legislators about.
And at a real local level, because a lot, you know, the zoning and the, you know, bonus density and some of the incentives that would be available to make housing more affordable are really, geez, I apologize.
Science here.
So
Trying to
okay.
talk to me. So what I don't know why this is coming off. Do you need permission? Can you still hear me?
Oh yeah, no, we can hear you.
Okay, I apologize, but the missing middle has been an initiative that Arlington County has been working on, which would be sort of a new zoning category, which would allow duplexes or sort of low rise apartment units that would have 3 or 4 units that of course would be more affordable than a single family home on the same lot.
Mm-hmm. Okay, let's see, just a couple more, and then Cheryl, we can go to the next thing on the agenda here. It's, let's see. Okay, so a question says, what is being considered legislatively for older adults and families who are vulnerable to terminal diseases and end of life? I'm not sure if that's something that has been discussed.
I'm not aware of something being discussed currently, but I just want to remind people in terms of the legislative season, this is the time of year that the legislators are getting bills drafted. So we don't yet know what'll be introduced for next session. That won't come, that won't start till later in November when people can start dropping bills. But I'm not aware of that discussion myself.
Okay. And let's see, I'll do a couple more and then we'll turn it back to Cheryl. Someone asks, and you may have addressed this, I apologize if you did. Do you support 10 days paid sick leave for direct care workers?
I'm supportive, but like Senator Favola, I question whether it's going to happen this session. I think that we'd be best focused our efforts on making sure that all the home care workers have access to the leave that was given to some.
Yeah, I think that's our best legislative strategy at the moment.
Okay, and then Linda asked, is there an opportunity to consider assisted living services to be further expanded to Medicaid?
Well, of course, Medicaid is a state plan, but we do get federal funding. It's a 50-50 match in Virginia. Every time we provide an additional service under Medicaid, there's always a very large financial requirement. So I really don't know what specific services you would be talking about. If you're asking if Medicaid would ever cover assisted living, if somebody were to move into an assisted living facility, that would be a debate that I think the Joint Commission on Healthcare and other study groups should look at. There are some states where Medicaid does cover assisted living. Virginia is not one of them. Medicaid does cover some, home care services under certain conditions in the Virginia model. So we'd have to get more specific in terms of where the Virginia Medicaid plan could grow and how it should grow, but it's a good conversation to have. And I think the Joint Commission on Healthcare could take that up.
Great. All right. Well, Cheryl, I think we've tackled most of the questions that I see on my list.
Okay.
Cheryl, I do have one more question, if I
Okay.
might.
Go ahead, Erica.
And that concerns guardianship, and the Joint Legislative Audit and Review Commission just came out with a long-awaited study on Virginia's guardianship and conservatorship system. And I don't know if any of the legislators have had a chance to look at it yet, but it does make some very worthwhile recommendations. For example, training for guardians, better report form, complaint form, and so on. So I just wanted to put that into the mix and see if anyone has a comment.
I haven't read the report yet, Erica, but I know that there are always several suggestions on how the guardianship model can be more transparent and how we can take steps to prevent abuse, especially in the financial area. So I don't know if we'll be having specific proposals again this year, but I'd be happy to entertain any ideas you might have on the whole guardianship area.
Thank you.
Before I ask for closing remarks, I think that I saw Babs Waters had her hand up. Babs, did you want to ask a question or make a comment?
I don't see it now.
I guess not. She can maybe, Babs, are you there?
Yes, no, I do not want to make a comment.
Okay, I thought I saw your hand up, so. Okay, well, we are at a point in which we would like to hear closing thoughts from the panelists. I believe we have three: Senator Evan, Delegate Lopez, and Senator Favola are still with us. And we welcome your thoughts. It's a new day here in Virginia, and not one that we expected. And you have done an incredible job of providing so much information and forecasting of what may happen, what may not happen. But we would welcome, we who are watching here would welcome what you foresee. You've made some comments already about it, but we would love to hear some closing thoughts about what you anticipate in the coming months in your position as senators and delegates with the Virginia legislature. So I'm looking across the screen here, so I will start with Senator Evan.
Thank you. Well, I think Delegate Sullivan put it well earlier when he said that the new governor, and in many ways, is a question mark, in that we have to see what his approach is going to be on a lot of different things. But I will say I want to thank NVAN because, or the agent community, because the materials that you provided us prior to, at least that I saw prior to meeting with Alexandria and Arlington's Commission on Aging, I think they might have been NVAN materials, were really comprehensive. And the one thing I'd say that we need to do is, particularly next year, is work with the administration when they develop their budget for financial proposals, asking them with real specificity as to what we'd like to see in the budget. And to do that, you can start doing that next summer. You can do it now with the Northam administration if you have entrees there, like the money for VICAP and so forth, because it's always easier to get things in the governor's budget than it is to add it to the budget on both sides and have it prevail in conference. But I want to thank you all for being such an organized community and providing such good information for us, which helps us be better advocates. So it's much appreciated, and it's good to see so many folks on the call.
Thank you, Senator Evan. Delegate Lopez.
Thank you all for being such amazing advocates and sounding boards for a lot of what we're dealing with on a regular basis during the General Assembly. I really do value my meetings with the Aging Commission. I really do value my meetings with NBAN, and so thank you for that. I never thought I would say this, but God, I love the Senate. The fact that the Senate is going to be there to help be a firewall, hopefully, against some of the bad legislation that we are a Jefferson manual state. What does that mean? That means that all the powers in the speaker. And so as a Jefferson, the speaker and the majority party on the House side, at least, can control, if they're solid, any bill that gets out. And so the Senate is going to be there to hopefully ensure that some of the more, culture war type legislation, some of the more egregious pieces of legislation are amended, modified, defeated. So it's going to be a very different time in the House delegates, and it's up to us to sort of navigate that. But once again, it's not as it was for many years when I was in the House, when we were at 34, 32 when I first came in, where we couldn't even sustain a veto. It's 48-52 right now, possibly 50-50 after the end of these inquiries and legal inquiries for a few of the races. But thank goodness for the Senate. And thank you for everything you guys do.
And I would be remiss if I didn't thank you, Delegate Lopez, for your membership on the Arlington Commission on Aging. And given the circumstances now of what's going on in Richmond, we will appreciate your input more than ever. So we look forward to your sharing your expertise and your wisdom with us on the commission. And finally, Senator Favola.
Thank you, Cheryl. Yeah, sure. Well, I join my colleagues in applauding you for your diligence in pointing out issues that are so important, and then following up with the homework and the detailed information. We need to really be a strong partner with you in addressing these issues. In my experience, and of course I had many years at the federal level in health policy, I would say that aging issues have garnered bipartisan support in many areas. So I think it would be, worthwhile going back and doing a little research. And when I first started in the Senate in 2012 was my first session, and the Senate was in Republican hands. The Senate has flipped back and forth by only one or two senators. It's been a very tight margin. And I can remember that some aging issues did garner support on both sides of the aisle. And I would, certainly programs to keep people in their homes have been very popular in a bipartisan way. Quality issues related to skilled nursing facilities have garnered bipartisan support. So my advice would be to reach out to groups who, may have the ear of Governor-elect Youngkin and his team, and talk to them early about where you think the aging community needs help, where you think aging issues are heading. Find out where their thinking might be, and see if you can come up with a pathway forward.
Okay.
Because it won't do us a lot of good if we end up going to Richmond in January and there weren't conversations with our colleagues on the other side. Everything is going to be, sort of brand new, and they're starting with a set of ideals that we're unaware of and didn't really talk to them about some of the issues that really we've worked on in a bipartisan way for 7 or 8 or 9 years. So that's my advice.
All right. Thank you, Senator Favola. With that, I will turn the program back to Babs and Linda for wrap up and thank you. Babs?
Okay.
Let's see, let me make sure that.
No. That was an excellent program this morning. And I'd like to thank everyone in our audience who joined us via Zoom. And thank you for your questions, which were quite thoughtful. I'd also like to thank those who worked behind the scenes to make our virtual event successful. And they are Steve Gurney, who was your Zoom master for the Virtual Legislative Forum on Aging Issues. Cheryl Beversdorf, who is the panel moderator. Helen King, Director, the Arlington Agency on Aging. And Terry Lynch, Director of Aging and Adult Services in Alexandria. And now I pass this on to Linda to thank our panelists.
Thank you, Babs, and thank you all again for spending the time with us today. I'd like to thank Senators Favola and Eben and Justin on behalf of Senator Howell, as well as Delegates Bennett, Parker, Sullivan, and Lopez. Thank you so much for being with us. This is really quite important to us in how we approach what we do on behalf of the older community in Northern Virginia. And as so many of you have mentioned, it will also impact those in other parts of the state. And we're very grateful to be working in this broad arena. I'd like to thank our time minder, Erica Wood, for keeping us on track. And I'd like to thank all of you for joining us today. Thank you so much. And I'm going to let Steve close out.
Great. Well, thanks so much. This was really interesting and engaging. And I just want to remind everybody that we recorded this session. And if you registered, you will receive a link for the recording, as well as a copy of the NVAN platform. And with that, I hope everybody enjoys the rest of their day and has a great weekend.
Thank you, everybody.
Thank you so much. This was very helpful, a lot of fun. Thank you.